The heart is one of the main organs in the cardiovascular system. The heart consists of four layers: the endocardium, the myocardium, the epicardium, and the pericardium. The heart is a muscle which consists of four chambers: the two ventricles and the two atrium. The two ventricles are the main pumps in the heart and are the lower chambers. The right ventricle collects deoxygenated blood from the right atrium and pumps it toward the lungs. The left ventricle collects deoxygenated blood from the left atrium and pumps it to the body. The left ventricle is much thicker than the right ventricle, since the left ventricle must propel blood across a longer pathway. The atrium are the two upper chambers of the heart. The right atrium collects deoxygenated blood from the veins and drives it to the right ventricle. The left atrium collects blood from the lungs and drives it into the left ventricle. The aorta is the largest artery in the body. The vena cavas deliver blood back to the right atrium. There is inferior and superior vena cava. There are four sets of valves in the body. The two atrioventricular valves found between the atrium and ventricles prevent backflow of blood back into the atrium. The two semilunar valves guard the bases of the ventricles and prevent backflow of blood back into the ventricle chambers. As we know by now, the heart acts as a pump to propel blood around the body. This is done through two circuits, the systemic circuit and the pulmonary circuit. Pulmonary circuit carries blood from the right ventricle to the lungs and back to the left atrium and ventricle. The systemic circuit carries blood away from the heart and to the tissues and back to the right side of the heart. If the heart was removed or stopped pumping, the blood would not move and tissues wouldn't receive nutrients.